Hello everyone, my name is Rashmi Sharma. I live in New Delhi, India. I am a nursing student at Norway University of Applied Sciences, which is in Vasa, Finland. Today, I want to talk about a very common yet a very neglected topic, that is mental health and depression. Sounds familiar to you? You must have heard this word depression every now and then. Every now and then a news comes that also people are in depression. This much number of people are in depression. So let's talk about it today in detail. Do you know that depression is often not even considered as a medical condition, especially here in India, and depression is mostly not considered as important as other health conditions. There can be many reasons for this, maybe lack of resources or lack of awareness and education among people, or family reputation or society norms attached to the word depression. But what is exactly depression? Depression is a constant phase of sadness and emptiness which interferes in the day-to-day life activities of an individual and his or her health. Now, you may ask me, what are the causes of depression? Why a person goes into depression? Well, first let me tell you one thing. According to WHO, around 264 million people worldwide suffer from depression every year. And there is also a study which shows that women suffer from depression more than men. When we look about the causes of depression, there can be many causes. For example, first we take family history. In your family, if anyone who has suffered from depression or is currently suffering, there are higher chances of you also going into depression. Another cause can be a childhood trauma or any brain injury or any accident you may have gone through, which may lead to depression in adulthood. Another factor that may cause depression may be pressure from your family or your friends or your colleagues at your work, or unemployment, which is one of the main reasons for depression nowadays. Another reasons can be chronic illness. Now, we can see that chronic illness and depression go hand in hand. Are you confused? Let me explain it to you. Chronic illness, for example, a person is suffering from cancer. Now, the person knows that he or she can't be cured and will die soon. Then, the chances of that person is going into depression is higher than other person suffering from any other disease. Another example is when a person is depressed. One of the main symptoms is that the person will not be involved in any kind of physical activities and may lead a sedentary lifestyle, which will lead to any health conditions. So we can say that chronic illness and depression go hand in hand, and one can lead to another one. Now, there can be many symptoms for depression that you can look in for a person. For example, lack of sleep or excess of sleep, loss of appetite, loss of interest, lack of motivation in work, in studies, unable to concentrate, anxiety, digestive issues, panic attacks, anything, mood swings, etc. These are one of the main and common symptoms of depression. Now, when we talk about types of depression, there are 3 types of depression, that is mild, moderate and severe. Now, let me tell you here that depression is curable and in certain cases, but in the worst cases, it may lead to suicide. Now, there are many medications and treatments related to depression, but there is not any diagnosis test for depression. However, your doctor or your healthcare provider may diagnose you with depression on the basis of some certain symptoms and then can provide you with certain medications and treatments. Let me tell you here that this depression, the feeling, the experience in the treatment is quite different for every individual, because every certain single individual suffer from this for certain reasons, and then however should be treated specifically. Now, there are many treatments for depression. First can be a medication. Your doctor will provide you with certain antidepressant or anti-anxiety pills. They will recommend you to go to a therapist that will help you get through this phase, that will help you talk your feelings, talk about these negative feelings, and help you go through this depression. Another one can be they will ask you to go to some light therapies or some massages that will help you calm your body and your mind. Another one of the high recommendations are exercises, doing any physical activities like going for a walk or going to a gym or doing any yoga or dance classes. Yoga has been very helpful in treating depression, so it is highly recommended to do some yoga because when we do some physical activities or any exercises, happy hormones are released in our body, which will help us get through the negative feeling out of our mind and help our body and mind relax. Now, when we talk about depression, we have talked about the treatments. Now, let me tell you here also that although there are many treatments related to depression, there are certain complications such as extreme weight loss or weight gain or self-harm, isolation, and in most worst cases, even suicide. Do you know that almost 8 lakh people suicide every year because of depression? And in the age of 15 to 30, depression is the most common cause of death. Sounds scary, isn't it? Now, as you already know, this 2020 has been a so depressing year for every one of us. Corona has been so hard for every one of us here. People have lost their jobs, they have lost their family members, their health has been decreased. They are forced to stay in their houses, maintain some social distance from everyone. They can't meet their families, they can't go to places, and it has led to so much depression cases. It is also assumption is there that 2020 has been the most depressing years in centuries because of the corona pandemic. But most important thing here is that you need to ask for help. It's always okay to ask for help. If you think you are in depression, if you feel this kind of sadness, a constant feeling of sadness, you should ask for help. Talk to your family members, talk to your friends, your therapist, your teacher, anyone you feel comfortable with. But always talk to someone. Otherwise, it may lead to some other deteriorating effects. You can also look for signs and symptoms in your family members and your friends. Be aware of this. Help them get through this phase. You may save someone's life. Thus, I just want to say that we can together go through this pandemic. We can come out of this pandemic healthily. So I think we always will be together, and we can overcome this pandemic and depression. Thank you.